won't tell you how many because I'm about to date myself. While I was doing a training in the community, and she was spicy back then, y'all. She's still spicy. And she was just fighting for the best for all the kids that she services through the mental health system in DC. So Joyce Ann Thomas is a national and international pioneer in child welfare, victimization of children, and domestic violence. Joyce Thomas is the president, CEO, and co-founder of the Center for Child Protection and Family Support in Washington, D.C., and director of Children and Family Institute in Silver Springs, Maryland. Providing leadership for quality services for children and families. She is also a past president of APSAC, so I'm going to fill very big shoes, I'm sure. Joyce Thomas is also on the board of the National Partnership to End Interpersonal Violence Across the Lifespan, and I'm so excited that she's going to share some history with us today and really just give space for all the Black pioneers that we get to stand on the shoulders of, who fought so valiantly for children and families. All right, I'm gonna turn it over to you, Joyce.
Hey, well, thank you so much. It is definitely an honor to be here. And as I get older, things begin to look a lot more clear. So my spiciness has just been dashed a little bit. But you know, when I think about it, it's so important to have that spirit, that energy, because there's so many things that need to be improved upon with our children and our families. I want to thank APSAC for, you know, it's always the case when you raise your hand and say something should be done, you end up doing it. So I do it with honor because I have enjoyed my time and my experience, both in the field, and I'm still very active, as you can hear, as much as I can, being a mother and a grandmother and a wife and a sister and all the other things that all the rest of us are. So what I'm going to do today is to really just highlight a number of people who've been so near and dear and who have really done the work of really getting us to think about this issue. And that's really the beauty for being around a long time. You know, we don't have a very long history as a field. So we're all pretty much in maybe the not quite the infancy stage, but certainly in the latency stage, maybe moving on to adolescence at this point. But there's a lot to be learned and there's a lot to be gained from understanding what has gone on in the past. So I'm going to use some slides. So Cindy or Sue, if you can set them up, we will get started. I want to begin by saying this is a celebration. It is designed to look at pioneers in the field who have made a contribution. And it's really somewhat designed on the people that I have had experiences with over the last 40 years because of my long history and having come out of an institution that was a pediatric hospital. There's a whole lot more that we need to know. Can you see me to change the slides? Good. The purpose today really is to focus attention and to foster some discussion and to really look at the outstanding practitioners and researchers that were our pioneers. I want to focus on those in the early to mid 70s to the mid to late 1990s. And I say that because, as you know, the whole field of child abuse, just the whole question of what are we calling it, came in the early 60s, in the mid 60s with Dr. Kemp, looking at physical abuse cases. So it's not a long history, but it is one that's important because it sets the tones for what we're doing today. In today's busy environment, there are so many people to pay attention to, and who've made significant contributions. So many of them are here, and many of them have passed on. We still want to recognize their energy, their commitment, and their works. And hopefully there are many, many more that we can look to in the future. I do have to make a quick disclaimer to make sure that we didn't miss anybody. If I did, I apologize, because it was the shortness of time and the limitations of resources. I didn't do an exhaustive search. And so there were constraints that I had to deal with. But overarching goal really is to stimulate dialogue and to really move us forward in the field as we look at all the issues of racial justice and systemic racism. We really have to try to understand that history matters. Next slide, please. The individuals that I am going to talk about today, they are pioneers and practitioners, or practitioners and scholars, who made a significant impact on the early development of the field. These leaders were innovative. They were willing to take on new approaches and to address problems that existed. And they really just pushed the boundaries to advance us in our thinking and really help us to look at a very overwhelming problem, but to experience some success by overcoming many, many challenges. I'm just going to go down the list, and each one will be highlighted with some comments from me, and then we hopefully will have time for questions and answers. But I will be starting with Dr. Frederick Green, who is a pediatrician, and I'm not going to say too much about them right now, just going to mention who they are, and then I'll individually acknowledge their contributions. Gloria Johnson Powell, Dr. Gail Wyatt, Dr. Carl Bell, Dr. Janet Hutchinson. Janet was both a pediatrician and a psychiatrist, and a child psychiatrist and an adult psychiatrist. She brings a wealth of knowledge. And my good friend Herschel Swinger, who is not with us, but there's a lot I could say about Herschel's contribution. Of course, Dr. Marilyn Benoit, who is a very gracious and very thoughtful and very compelling person in the field, and she is still active. I understand she recently did a forum in New York at the Foundling on child abuse, and so it just really highlights the depth of her knowledge over these many, many years. And of course, Bob Hampton, Dr. Robert Hampton, we called him the Godfather because he's a sociologist and he's a thoughtful, deep thinker. And he's always the one that raised his hand and say, but wait a minute, let's look at it this way. So it was a refreshing experience having Dr. Hampton in any of our circles, and I will speak of him. And last, but certainly not least, is John Holton, who you don't hear a lot about John's work today, because he's broadened out, but he was really key in the early days of child maltreatment development. Again, he is a research psychologist and brought many of the details that we need to move us forward. Next slide, please. I could never say enough about Dr. Frederick Green. And Dr. Green is a lifelong advocate for children. He developed my feistiness. He was my mentor. He gave me the freedom and the spirit to really deeply care about advocacy. I remember many, many lectures that he had on what advocacy is, that voice for people who did not have a voice. Dr. Green came from a very meager background and put himself through medical school. In 1971, he served as the associate chief of the Children's Bureau. He's also a former vice president of Children's National Medical Center here in Washington, D.C. And he was the past president of, used to be called the Committee to Prevent Child Abuse, which is now called Prevent Child Abuse America. He brought the deepest thinking about prevention before we even started to really look at it. We were so overwhelmed, we being those of us in the field, with the number of cases, the type of cases, the complexity of cases, and all of that. But there is a stronger message as to who was throwing the kids in the river upstream. And this is where Dr. Green was the voice that helped us look at how these nexus occurred between the elements of children being abused, parenting, the environment. He did a lot of work. Next slide. He did a lot of work on issues of lead poisoning. He was a fierce advocate and was a great companion to me. And these pictures are a little fuzzy because I didn't see a clear picture of him on the website. So I had to go back into my stash and photograph. And I always used to tell him he was the person who took me from crayons to perfume. He literally saw me as a young clinical nurse practitioner and really literally groomed me into being exposed to all the environments of international communities, as well as high opportunities in high organizations to carry on the message. He is well awarded. He was Washingtonian of the Year. And he really was like a big teddy bear because everybody loved him. And when he walked in the hospital, he was a big guy. And everybody walked into the hospital, everybody was saying Rick. So we didn't even get to the Dr. Green or the Frederick part, it was just Rick. And so he was the one who was the first child sexual abuse program in a pediatric hospital in the country, was out of Children's National, and that was the work of the Office of Child Health Advocacy at Children's Hospital. So we want to, Dr. Green is not with us. He had an enormous sense of humor, and he was also just a very stern academic because he served on many, many committees. Next slide, please. And Gloria Johnson Powell, she's another dear friend. She was a quiet woman, but so brilliant. She looked very strongly at the issues of child psychiatry. She also she was involved in the civil rights movement. She was involved in, she was the first medical Black African-American person to get tenure at Harvard University. She went from the West Coast to the East Coast, to the middle of the country, always talking about the needs of children. Her contribution in my mind was to help us look very closely developmentally at the psychiatric needs of children, to make sure that when we are talking about symptoms, we're talking about behaviors, that we keep in mind what were the expectations. Gloria was very involved in numerous communities. And I believe Gloria was the one who really spent a lot of time working with young psychiatrists and getting them to focus on, specialize, and look at the issues of children. And I believe she was the mentor to our own David Corwin many years ago. Her contributions are continuous. Next slide. So Gloria was a prolific writer, speaker. She's been in many environments. I only picked a sample of the kinds of things that she wrote about. She was very appreciative of her own mother, who she describes as a welfare mother. And she describes what it was like being raised by a young single mom, and at the same time, moving herself. She collaborated with many professionals in the field. And one of them is who I'm gonna recognize yet is Dr. Gail Wyatt. They worked together at UCLA. They worked together on production of publications. They often were in different ways speaking and addressing similar issues around the country. Gloria is, I just miss her. She was wise and she had a sense of humor. And I remember we were going together to an event, and we had to travel in the car for quite a while. So we had on our jeans. And by the time we got close to where the event was, we went into one of the fast food places to change our clothes. And we just started laughing. We both said, oh my goodness, if anyone sees us in here, Dr. Gloria Johnson Powell and Joyce Thomas, and we were there trying to get our clothes together and get ourselves together for this event. And we came out giggling like two teenagers. She is just such a remarkable person, she was, and she is greatly missed. Next slide, please. And what can we say about Gail? Gail is a clinical psychologist. She's a board certified sex therapist and professor of psychiatry and behavioral sciences at Seminole Institute of Neuroscience and Behavior at UCLA. To my knowledge, Gail is still there. I did leave her several messages to let her know that we were doing this today, but I haven't been able to reach her directly. But she and I have been good friends for so long. I felt totally supported by many people in the field, and it only helped to motivate, help me grow, and help me search more for answers and ways to doing things. Gail was a prolific writer and had written so much, published so much, and also was constantly here in Washington, D.C., giving congressional testimonies before Congress. And each time we would find time to get together. Next slide. Gail was the author of many just legendary books and materials, and all of it was related in some form of looking. The first one was sexual abuse and consensual sex. This was actually the first book that was looking at some of these issues that were related to relationships between social and psychological behaviors. And it was, I think it's out of press now, but it was done early in 1993. And if anyone has a copy, I know if you look on Amazon, you won't be able to find it because it's out of print. But it really is excellent. And I've been writing to Gail to see if I can get an old copy just to go through it in more detail. Her book, Stolen Women, that was on the bestseller list. And it really was an in-depth look at issues of reclaiming our sexuality. She was speaking to African-American women about African-American women, and from herself being an African-American woman, the depths of knowledge all the way from the period of slavery and oppression and where women are today. I believe this book is still available, and it is well worth reading, particularly as we think about the issues of domestic violence and how that plays into our own perception and our depth of thinking about ourselves and about sexual issues. And the other book, the last book that I'm highlighting, she has an extensive, I felt really, compelled to say the bios of each individual was like a who's who, and it was almost difficult to pull out one simple thing. But certainly this book, The Lasting Effects of Child Sexual Abuse, really is kind of the encyclopedia of understanding what was going on in the early days. And there are sections and segments in there that really reflect what we call today as trauma and what we're looking at today as the long-term effects as we look at the various studies that really bring us to see how something as unpleasant and difficult as sexual abuse can really extend for years to come. Next slide, please. And my good friend Carl Bell, I was so set back when I heard he passed away a couple of years ago. Now, here was a controversial person. I met him at an event where he was talking about head trauma, and he was really talking about head trauma as it relates to African-American boys who have been hit and beat and just had many changes. Carl was very controversial in his ways, but he was also very thorough. He brought the reality that mental health services must be in a community setting, that we need to understand the environment we understand poverty, we must understand the backgrounds as we're looking to make a diagnosis. And he sometimes challenged the standards of what we were calling different diagnoses for African-American children. Carl was, in his own way, just so available. He and I have done a number of television shows together, and you could say it was a feisty day with the two of us because we so agreed, but at the same time, our environments were very different. I was looking at the public health, the policy issues, the physical manifestations, the things that I was seeing every day in my own practice at the hospital and then later in the community. And he was supporting that, but also looking a little deeper into the mental health, the DSM-3 at that time, all the way up to the current. He had the most original ideas about how things link together. Then he went about to study, did they link together? And sometimes they did, sometimes they didn't, but he certainly was very out there looking at it. He also was very, very involved with really understanding the needs of children. Next slide, please. Carl was a man of many hats. I was looking at all the different hats that he wears. And I remember a time when we both were at the Congressional Black Caucus and he was a speaker. We were actually on a panel and he came in with this atrocious cowboy hat on. And so he gets your attention before you even opens his mouth. And then when he starts to talk, you're just blown away. He was a frequent visitor on all kinds of media, but the Black media really did gravitate to hear what he had to say because he was telling a truth that hadn't been told. And he had all the credentials and background and spirit to make us listen. Now, he was totally an outspoken person, but he was keenly intellectual. He knew the literature. He supported things that were within the context of the clarity that he saw it, but he certainly challenged some things. And where is that today? Where is that kind of individual thinking and open-mindedness today? I think we may need to create that again. Carl will be deeply missed. I work with his assistant, who is Dr. Esther Jenkins, a psychologist, who is a dear, dear friend of mine. And we were talking about Carl, and she just went on to tell me other things that he was working on. He became ill and succumbed to his illness, and he will be deeply missed. He is deeply missed. Next slide, please. And then there's Dr. Janice Hutchinson. I'm not sure how many of you know Jan, but Jan she's a pediatrician. She was a psychiatrist, adult psychiatrist and child psychiatrist. She practiced in many environments. She's another person who shared with me her close connection to her own mother. And she lost her mother, and it was very profound to her, as she described. And it's really the thing that made her really try to understand all the elements of what young children go through in different relationships with their parents. Jan was a free spirit. She certainly was out there with all the academic glories of completing medical school. She traveled internationally. She went to a number of African countries and just was marveled on the beauty of them all. She definitely talked about the complexities of psychiatry and helped us understand that we have to look at the whole child, their environment, and the circumstances of their environment. Next slide. Jan is still practicing, and she was at Howard University. She does independent work. I most recently saw her when we were at the Kennedy Center, and we just adored each other. She really taught and wrote about child abuse, and she asked me very hard questions because at the time, when I was at Children's Hospital and even beyond, we saw a lot of kids in the community. I saw a lot of kids in the hospital, and just looking at them from, again, the lens of a pediatric nurse, then you really need to get a little deeper, a lot deeper into the psychological and developmental needs of these kids. And Jan was instrumental in helping give me that insight, and doing it in a way that you remember it. Next slide, please. And Herschel Swinger, that name works for him because he definitely was out there. He had a very deep voice. He was very, very renowned clinical psychologist. He worked at Children's Institute International, and there was so much going on in those days. We had those very high profile child sexual abuse cases at the Manhattan Beach daycare. And Herschel was just a steady force working with Key McFarland and working alongside of Dr. Astrid Hager. And at the same time, coming through with a clear message of his own as an African-American male. He was in the early development of fatherhood programs to really say, you know, we have to look at the whole family. And as we do so, we have to look at the father and who the children relate to as fathers. And so his work was, it still exists today in California, because he was just very adamant that parenting makes a big difference, and fathers are important, and they can make a difference, and they can function. You hear so much about, you know, whether people are not in the home, whether they were in the home or not, they were still the father in his mind. And he brought that strong message to the parenting programs that we see today. And there was a whole fatherhood movement long after he had started this, that had all the bells and whistles of scientific measurement. And it's a credit to him that we see. He was a tall guy, so I was a little vertically challenged short person, but he would just, you know, just eat up all the information, because he asked me continuously about the kinds of cases that I was seeing. And he said, are these Black parents hurting Black children? That was a question. And I'm like, yeah, that's what we're talking about. He says, well, we have to talk more about that. Next slide. So his real major thing was to make sure that dads at every stage of development, from time of pregnancy to the newborn period, to the infant and toddler period, to adolescence and beyond, he made sure that the fatherhood was a primary thing that we think about in terms of prevention of child abuse. Next slide. Next slide. And certainly moving into what could I say more about Marilyn Benoit? She was the most gracious and continues to be deeply educated and thorough psychiatrist, and well respected throughout the world. She actually was the past president of the American Academy of Child and Adolescent Psychiatry. And she had a national presence, a national voice. She was at Children's Hospital in Washington, D.C., where I first met her. She went on to work at Devereux, which is a psychiatric inpatient facility. She is still practicing today. I spoke with Marilyn. Hopefully she's on the call and could say hi. I'm not sure, but she certainly was so thankful to that I thought of her as one of those visionaries, because I remember all that she said to me during the very troubling days of trying to deal with high numbers of abused and neglected children, and very little resources to deal with it. And we talked about how we can make this a situation where funding is not always our biggest priority, but funding still is a big priority in the field for many organizations. And so this is why programs such as APSAC is so vital for people in the field to stay connected, to be able to look to see colleagues who are accomplishing great things with sometimes limited resources. Next slide. I only highlighted again some of the publications that Marilyn has been involved in, either as reviewing books or editing books or writing them herself. She is very thorough. She did write the Handbook on Child and Adolescent Systems of Care. She worked continuously with others to make sure that the services and the kinds of work that we're doing is very measured and is very clear. So I really, really thank Marilyn, and I will be back in touch. We had a nice conversation, and she asked me, well, have you talked to this person? Have you been able to reach that person? Because sometimes as we move along, sometimes we lose connections, and it only takes a few of us to remember how important each person in this field is to the accomplishment of our goal, which is to improve the quality of life of children who have been abused and neglected, and to make sure that future children avoid the traumas of victimization. It is something that has not gone away. I remember the media used to ask me this question, Joyce, you know, how do you get up each day and deal with this? And I just told them, well, I just can't have any problems in my personal life because I'm dealing with everybody else's. And that was sort of a way of lightening up the burden that many people have to prevent burnout. You have to be a marathon runner. You can't sprint. And consistently looking at ways to keep yourself engaged. And Marilyn talked a lot about that. And she certainly believed in it. So we are really grateful to her. She is still, many of you are looking for a wonderful speaker. She is still consulting and doing work, not as much like all of us. We're trying to take a little bit of a step back, but she is there. And I just hear great things about her all the time. Next slide, please. And we have Bob Hampton. Bob, please forgive me for you calling their first name, but these are colleagues that have been, you know, in our lives. And one thing about the field of dealing with child maltreatment, no matter what your discipline is, it's so comfortable to have colleagues that you can really ask hard questions to clear up your own thinking. And we used to go to Bob like he was the encyclopedia. He was a scholar par excellence. He was president of a university in York College. He was the provost at the University of Maryland, and he's also was a provost at Tennessee State. So there was so many things about Bob's background. He served also on the committee, the Institute on Domestic Violence in the African American Community. And we always look to Bob for, you know, we get into a debate about this should be and that should be, and the clearest thinking, because he could step back and provide that data, that documentation to help us understand exactly what we're saying and what we're saying clinically. How is that backed up by the science and literature? I can only tell you Dr. Hampton's been around a long time in the field. He worked with Eli Neuberger up in the Boston area, and definitely was very, very well spoken and very calm. You never saw him rattle. He just was always very calm and thorough. Next slide. He has written, and I recall that he was one of the panel members on understanding child abuse and neglect. There have been a number of people on that panel that really sought through definitions and what are we calling this, and when should the government get involved in children's lives, and how should we proceed? It's all of these kinds of questions and these kinds of issues that we had to wrestle with. His current research, and his research is very heavily looking at Black family violence and looking at the theories behind it and how that plays into prevention and treatment. What we can say is that there is a very distinct person. He just retired, and so he's not active right now, but he is active for those of us who have known him personally. And as I'd say, he is a research scholar looking at the whole social dynamics of issues related to families where violence is an issue. These two slides just don't do justice to the depth of the knowledge of these individuals that I have put before you. And I believe there's one more, and then we can open it up for discussions. You can pick what's left of my brain. John Holton, Dr. John Holton, I've tried to reach him to let him know, because he probably is one. He is right now at the School of Social Work at James Adams in Chicago. But he is a scholar who brought to us the idea of, first of all, prevention. He worked for Prevent Child Abuse America as their senior researcher. And he also was very, very instrumental in identifying how do we measure the cost of child abuse. For those of us who are involved in grant writing, you know, we told the stories, we had the data, we saw so many kids, but he always asked the question, well, who's paying? And I know CDC has some updated approaches for looking at the cost of child abuse, but the work that Dr. Holton did really just set the tone, because it was done through Prevent Child Abuse America along with his colleague. And so we had an opportunity to talk a lot about that as I was trying to myself sort out a number of things as we were looking not only at child abuse, but child abuse and drug abuse and child abuse and domestic violence. And the nexus went on from there, but we started with looking at the clinical. Next slide, please. We started looking at inpatient costs, foster care costs, medical costs. And you can imagine, I didn't put the numbers up because it was, it's not relevant today. The numbers are even higher than they were in 2007. But the concept that we have to look at just the overall, not only the human cost we can't measure, but if we look at the actual financial implications of this work, you can see how all of us have been doing a tremendous job, but certainly it's something that society has to understand. It abusing and neglecting children is very, very costly in many, many ways. It's the kind of thing that you can't put a price tag on. I think that those were the 9 that I was planning on talking about. I want to hear from some of you. I want to thank APSAC and the Commission on Racial Justice in Child Maltreatment, which is a new commission that I have the honor of participating on. But I want to thank them for just having the conversation and listening that this would be an important starting point. It's just a starting point to really look at some of the work that we have done in the past and to honor and celebrate the accomplishments of these wonderful people. The history provides specific lessons that can inform us about our decisions that we have today individually and systemically. So as we look at systems bias, overrepresentation of African-American children in the child welfare system, when we look at the lost children in the foster care system, the children who are just neglected, and even to today's issues of children being trafficked and children being missing, we still have an enormous task ahead of us. And those of us who are stepping off the treadmill because of age, we can't keep up anymore. But there are young people coming on, and think about who you can mentor, who you can bring to the next level. I am very fortunate. I am currently mentoring 2 young professionals. Everybody's young to me, but they are young professionals, and they are doing an amazing job. And the interesting thing is they were given an opportunity to be mentees, and they had a whole lot of people to choose, and they both chose me. And we do meet, and I feel like whenever I stop, whenever I say that's enough, I know that there are professionals like Ernestine and Viola, and oh goodness, I'm not going to try to mention all of the wonderful people that exist today to carry on, and we need to do that. So I'm going to stop here and allow time for question and answers, and let it open up to the group.
Oh, I hope you will all join me in giving Dr. Joyce Thomas a round of applause. You can do it electronically. I will tell you that this was born out of a conversation we were having on our commission, and she just dropped so much history in that hour that we were all blown away. And I am so thankful for you, Joyce, for sharing some of these legends with us. I've had the opportunity to read many of the folks that you've talked about and see, like Dr. Gail Wyatt on Oprah, and
Yes.
and rub elbows with Dr. Carl Bell, who tops you in spiciness.
He's
for
spicy.
sure.
Good.
But to just hear about your personal experience and knowledge of these legends, these pioneers, these folks that really shaped the field that we often don't hear so much about. I just wanted to say thank you for sharing. All right, y'all, you have an opportunity to put lots of praise in the chat, Joyce, but feel free to put some questions in there. Let's see. Oh, here's a question. What is a nexus of ACEs, adverse childhood experiences, and racial justice and child maltreatment? Can you say a little bit more about that, Joyce?
Yes, no, the ACEs really grew out of a study that we know was not looking at child abuse. It was looking at other factors. And it was very clear that the persons who were, this was part of the Kaiser study, they were looking at where and how certain kinds of behaviors. And the nexus is that, you know, as we treat and intervene in child sexual abuse in particular, but certainly other elements and traumas, these adverse experiences, the goal is try to reduce them and to make sure that children are not in a situation where they have high numbers of traumas that result in forms of victimization. So I think the nexus is really, if you look, and I think Gail Wyatt has looked at this in her work, you know, looking at adults, you go back to the fact that many of them have experienced early childhood traumas. You look at the number of traumas, and then you look at the degree of their behaviors. And I'm not sure if someone can answer that a little more clearly, but certainly there is a nexus. We talked a lot about nexus when we talked about domestic violence, is how one problem links to the other problem, to the other problem. And that's what we see continuously.
I think some of the legends you talked about, and I'm thinking about Dr. Hampton and Holton and some of the work of Gail Wyatt, and the one that you did not mention, Veronica Abney, really talks about racial trauma and culture and that role and how we are to understand all of those influences and how they intersect, right? Like we're not just one thing, we're these combinations, these intersections of identities, and really to really stop, prevent, treat abuse, you have to be able to speak to all of those facets. Absolutely. So I think that's a really...
Veronica and I were dear colleagues. I tried to limit it just from a time point of view, because she did come significantly after that early days when we were really struggling. You know, when I say we, when I was at Children's National, it was the first child sexual abuse conference in the country. We did it out of our multidisciplinary team. We didn't have all of the electronics and things that we had today. We would go from the emergency room being on call to sitting down and trying to plan a conference. And we realized when we had that conference, it got bigger and bigger. It got so big, we couldn't do it anymore in the hospital because it really just required so many pieces. And certainly there was many who came together at the 4th National Child Sexual Abuse Conference, which was my last one in 1985, I believe it was, at Children's Hospital, to say we need to start a professional organization. And so I was trying to deal with people who were really in that room to say, this is where we start. Veronica, I mentored Veronica, brought her in, and she kept saying, well, who's APSAC? But now, and she moved from who's APSAC to being president of APSAC. And so she was just a major contribution. And I know that there may be others that just deserve it, but I only had an hour, so that's it.
I totally appreciate that. All right, let's turn to some more questions. Were there any works by these influencers on the effect of unresolved trauma on parental bonding? Any insights on management?
I think Gloria Johnson Powell spoke to this continuously because she was at least early in my mind to look at the issues related to the parents' own prior victimization. And we talked a lot about prior victimization, very unresolved prior victimization that came out, which really sometimes complicated cases of treatment for children. There was an incident where a mother, without going into the details of where it was, where a mother had heard her child had been sexually abused, and she was so upset because she had been sexually abused. And then she really kind of went into a psychiatric crisis on her own from her prior victimization that had not been treated. So the whole notion of really looking at the whole family and how this is done depends on the kind of therapeutic interventions that they have and the openness. There's sometimes difficulty because of funding. The child may be on Medicaid, and the mother may or may not have any coverage. I think we are now at this point in time really looking at mental health services in a whole different light, particularly since the pandemic. Now it seems like the broader community is saying, yeah, there's something to this. Whereas in the past, there was a stigma and there was an isolation. It was the thing that people didn't talk about. In the field of victimization, we recognize that you can't help the kids unless you help the parents. That's kind of a basic in parent education. And as we look at even with domestic violence, we cannot exclude the needs of the families that surround the lives of the children that we intervene with.
All right, there's so many vying for your attention. I'm just going to ask you one quick question before I turn it over to Dr. Corwin. What are you most proud of, looking back at your long years of service to the field? What are you most proud of?
Well, I think I'm most proud of taking the knowledge that I gained when I was in the acute care setting of the hospital and bringing that to the community. I have had an amazing 35 years of running the Center for Child Protection and Family Support and continue to be active all over the world. And each time I realize it builds on my training as a public health nurse. It builds on my desire for education. I've had the freedom to really investigate the things that were most important to me. And I found the resources. I learned how to find money to make it happen. So I am most proud of the organization that I started. And I'm also so proud of the young people that I've mentored. We had close to, in a community-based setting, I think I had close to 400 students come through that facility. And it was amazing to see them go from the awkward stage of a student to a young professional, to accomplished professional. I can just never say enough good things about the people who, and they're all like my little proteges right now. they all, you know, are just so rich in knowledge and so self-assured. And that's a good feeling.
Okay, so we gotta say, we have some greatness amongst us. Dr. Holton, do you wanna say just something really quickly?
Oh my goodness.
Hi, Joyce.
Hey, how are you?
I'm doing well. I thought I was in the witness protection program, but obviously I wasn't. You found me. Thank you, Joyce.
So good to see you. So good to see you.
It's great to see you. And I don't deserve mention with the pioneers that you have talked about today. I will say that it's not easy being a pioneer, as you talked about, and perseverance and sustainability are not always easy to accomplish. And I just applaud you deeply and sincerely for remembering the individuals like Dr. Rick Green, Dr. Carl Bell, and the others. They were certainly influencers to me, mentors to me, and they sustained my career in ways that I really can't understand to this day. But thank you, Joyce. Had it not been for you in this presentation today, I might have missed the essence of Black History Month in 2022. So thank you so much.
Thank you. I just remember, John, all of our wonderful conversations, and you were just always so clear, and sometimes I was so fuzzy, but when you finished, I was a little clearer. And I'm so happy to see you. I haven't seen you in years, and I think that the thing that's most important is that you're still doing the work. For those of us who are able, it's important. And you know, I was going through this and I was talking to my good friend Oliver Williams, who's just a dear, dear colleague. And I was kind of going through who I was talking about, and he says, well, Joyce, you remember? And he says, who's that fellow that you always talked about? And then I said, it's got to be John Holton. And he said, yeah, that's the one. And so I started digging to find out where and how I could at least acknowledge, because I think after you did that very early work in looking at cost factors, that helped me get on the road of knowing how to talk about the need on a financial basis to the people. And Rick Green was the one who always, he was the advocate. I mean, he would stomp his foot and, you know, the trees would tremble. And he sort of taught me how to make that message heard by people who really didn't want to listen. So I thank you very much for that.
All right, Dave, please talk about the founding of APSAC. And
I want to acknowledge Joyce Thomas and her colleagues from Children's National Medical Center, who worked with some folks from out in California, including myself and others, to put together the organizing of the initial founding of APSAC. And I remember when Joyce stood up, it was actually in May of 1986, and I believe it was in New Orleans. that you stood up and asked if it was now time for such an organization, and 2,000 people said yes. So great work. I think you should be proud of your role in the founding of APSAC, as well as all the other great things you've done. And this presentation, as Joyce and I talked about it, will add to the illustrated history that APSAC has in its video library about the history of the development of this field. This is an important chapter, and of course, the history is never done. So others who have good ideas about other people that need to be acknowledged and work, and in the future, there will be more chapters. So thank you to Joyce, her colleagues, Carl Rogers, David Lloyd. Good work.
Mimi Kander. There was a lot of colleagues, both at the institution, at Children's, and really around the country. And many people took me under their wings, both to be supportive and also to guide. So I thank all of you in return. I'm not sure who's monitoring the time, so I'm open to another question if there is one.
Well, we want to be respectful of everyone's time. There's lots of appreciation and love for you in the chat that we'll make available to you, so you can just see how many big thank yous there are from the audience. I want to again thank everyone for just taking a moment out of your day to celebrate Black History Month, learn a little history, and spend some time with us here at APSAC. Thank you, everyone. I appreciate it. Thank you, Joyce.
Thank you. Bye-bye.
Bye-bye.